Hello, everyone. So, I'm going to be adding our special guest. We're talking about screening for breast cancer. You know, it's Breast Cancer Awareness Month, and I have a special guest to talk to us about it. So, yay! This is Dr. Toma Omofoye. We finally
We made it happen. I
made it.
had every single, technical mishap has happened today, but we're here.
We're here. Thank you for being here. Really here.
It's my pleasure. Can you hear me?
Yes, absolutely.
Okay, good. Good.
So I was just telling our audience, this is exciting because we have very special guest, Dr. Toma Omofoye, a breast imaging radiologist and associate professor in the Department of Breast Imaging at the University of Texas M.D. Anderson Cancer Center in Houston. And we want to take a deep dive into breast cancer screening, this very, very important topic. So thank you for joining us, all of you that are here. And we're just going to go ahead and get started. So first, to say thank you for coming.
Thank you for having me. We have to let the audience know this is completely biased because, Dr. Ashaye is one of my favorite doctors, one of my favorite friends, such an outstanding physician and mom and friend. So I couldn't say no. So this is going to be interesting because I have to try to be a doctor when I'm chatting with my friend. So we'll see how this goes.
Great, you're going to do great. So thank you. What would you like to share about yourself personally or professionally?
So I'm a breast radiologist, like you mentioned, but I think that as I've grown in my career, you start to see things just beyond the textbook. You start to develop more passions. And one of the things that has been an area of deep passion for me has been breast cancer risk in young women, especially young Black women, because this is a demographic that I'm protective of. I mean, I think it's important that every woman, every man has access to good breast care, but I especially see disparities in this demographic of young Black women. So that's something that I'm passionate about addressing here in Houston and globally around the world. So thank you for the opportunity to share about breast cancer.
Yeah, awesome. Yeah, this is something preventative care, so something I'm very passionate about as well. So as an associate professor, and you see a lot of cases, and what are some of the lessons learned over time that you think maybe this case has been prevented, or maybe we can do things a little bit differently?
Yeah. So I think the first thing that I would like for everyone to know is that every person has some risk of breast cancer. I think that a lot of people think breast cancer is more likely to happen to you if you have a family history. So if you have no family history, you're not at risk. Or in some cases, you'll see where men think they are not able to get breast cancer because they're male. And so they just will ignore symptoms for a really long time. So I think the first thing I want everyone to know is any human being, any person has some risk of having breast cancer. We don't really say that anyone is low risk. We actually will say that somebody may be average risk, intermediate risk, or high risk. There's not truly a low risk category unless you're talking about somebody who's had their breast completely removed. So that's the first thing. The second thing that I think is important for people to keep in mind is that when we talk about breast cancer, the earlier it presents to healthcare, the earlier it presents to the doctor for treatment, the easier it is. It's at that point you become eligible for treatment that is of the treatment options, and you usually have a higher survival rate. So breast cancer is one of those cancers where diagnosed at its earliest stages, it is actually incredibly easy to treat. Well, not easy to treat, but able to be treated. So breast cancer diagnosed in stages 0 or stage 1 or even stage 2, we're talking about a 5-year survival rate that's, in the 90s, 95 to 99%. So really excellent survival in those first stages. And as the cancer has time to grow and spread in the body, you see that the survival is just not as high. So if you have the ability to successfully treat something, if it's found earlier, you just really want everyone to know, please show up as quickly as possible. Let's try to get that treatment done quickly.
Yeah, that's, and the thing is, that's true for a lot of medical conditions, right?
Mm-hmm.
Try to encourage people to please come in sooner rather than later, because it makes such a big difference.
Yeah.
So yeah, mention that. So let's talk more about that, because breast cancer doesn't always cause, so that's one of the things, but sometimes it does, and sometimes risk factors that people can pay attention to. So what are things that can help people determine whether or not they should be seeing a doctor?
Yeah. So the first thing I'm going to say is that when we talk about the signs and symptoms of breast cancer, they're the same in women as in men. Okay. So a lot of the time, men, even though they're less likely to get breast cancer, when they do, they are completely unaware of the signs and symptoms. And it's usually a woman in their life that tells them to go in. So when we have this conversation about signs and symptoms, I just always put a plug in, hey, just keep this in mind as well for the men in your life, your brothers, your partners, your friends, because you may need it to save their lives one day. So every symptom that we think about with breast cancer, we think not just about the breast itself, but we also think about the axilla or the armpit, because your breast tissue naturally goes up into your armpit area. So the signs and symptoms, you have to be paying attention to the breast and the armpit area. So start by how it looks. So if you see that the shape of the breast is changing, you see that the skin of the breast is looking really thick. We describe it as it looks like the peel of an orange, where you can see every pore in the skin. That can be a sign of breast cancer. If you look at the skin and there's like redness, redness can certainly be infection. It doesn't necessarily mean cancer, but it could be a sign of a particular kind of cancer. So we want to get that addressed as quickly as possible. Also, the lumps, and people, this is the one they know about, a lump, specifically often a painless lump. In many parts of the body, you're waiting for pain to go to the doctor. In the breast, it's actually the opposite. The painless symptom is actually more worrisome. So people, when we talk about a lump, may go, well, this isn't a lump, this is like a ridge. This is like a hardness. This is a bump, It doesn't matter what you call it. I'm not proud. If it feels different to you, go ahead and have it evaluated. So you also want to be looking at the nipple area. So is that nipple suddenly kind of moving to the side? It's changed in direction. Has the nipple pulled in? If you've had nipples since puberty that have always been sticking out, if suddenly your nipple pulls in, that's something that we would be worried about. If your nipple starts to show discharge that you haven't had, so especially if that discharge is bloody, we would be concerned about it. And then if the skin of the nipple changes as well, sometimes people in this particular kind of cancer will get a very dry rash to the nipple area, and you put creams on it. It looks like eczema. They keep putting creams and it doesn't go away. This is something that would have to be evaluated as well. And so if we talk about the armpit, we're also talking about these things. If you're seeing a painless lump, if there is redness, if there is like fullness in the area now, if the skin looks different, you want to present to your doctor's office to have imaging. So present to your doctor's office so that they can help you get the order to have imaging done to evaluate that area. The truth is that none of us are perfect. And often by the time you're even seeing a change, things have been happening on the cellular level for a little while. So when you see a change, that's not really the time to start waiting. You already kind of need to be moving quickly. So any change that you have that's lasted more than 2 weeks, you need to get over to your doctor's office, try to get initial evaluation, and then get the order to come into a breast imaging center so that you can get a full eval.
Absolutely, yeah. And that's great that you said that, because I think sometimes people, especially when, as you mentioned, when there's no pain involved, people wait and see and try all kinds of things. But it's just better, just come in, we'll check it out. That, we can send you to the right, you figure out the right way to go. Awesome. Thank you for sharing that. So let's take a deep dive into screening methods, because these days there's so much health misinformation, and you hear all kinds of ways that people are saying it's okay to screen for breast cancer this way or that way. Wanted just to, from your, experience, all the training you had, just if you tell us what is the best way to screen for breast cancer?
So there are different ways to screen for breast cancer. And with each screening method, we're always weighing the risks and the benefits, because everything has its own downsides. But with all of the research, and we're talking decades upon decades of research, what we know to be the workhorse that does the best job of finding breast cancer with minimal side effects and increased availability, increased access, is mammograms. I know some people are going to be disappointed to hear that, but it's true. It has been evaluated over and over and over again. Mammograms are wonderful. Now, the reason I say that we're weighing the risks and benefits is that there are other tests to screen for breast cancer, and some of those are very effective as well. So MRIs, breast MRIs, are incredibly sensitive at finding breast cancer. But MRIs are tests that require you to have an IV, to have a special contrast. You have to lay on this table really still for a set amount of time. It has all of these other parameters around it. So we don't recommend it as, necessarily the tool that every average person needs. Mammogram is a tool for every average person. Sometimes if you need additional, we may add on an MRI. Ultrasounds are more common, more available, right, than the mammograms. But an ultrasound by itself doesn't detect every version, every way that breast cancer can present. Ultrasounds can be extremely helpful when added to mammograms. So, for example, in people who have dense breasts, having annual ultrasounds after they've had their annual mammogram can be really helpful. Now, what is breast density? People always ask. Breast density is not about how your breasts feel. It's not about breasts that feel lumpy. Breast density is a designation that can only be made after a mammogram. And what it means is that you have a lot of breast tissue compared to the fatty tissue in your breast. So it photographs, really white, if we're talking about a black and white picture. And that breast density, when it's really white like that, it means that it can more likely hide a cancer, but it also means that you may be more likely to develop a cancer because you have a lot of the cells that can turn into a cancer. Someone described it as looking for cancer in dense breasts is like looking for a snowman in a snowstorm. You can find it, but you just have to work really hard. So for women who have denser breast tissue, we'll often recommend, you may get a little line at the end of your mammogram report that says, consider supplemental screening. So those women will often get an ultrasound every year in addition to their mammogram. They can certainly do supplemental screening with MRI as well because it works, it's very sensitive, it's very effective. But for the average woman who is trying to evaluate their breasts, mammograms, mammograms, mammograms.
Awesome. Yes, thank you for saying that. And as a primary care doctor, I get, those questions a lot, and especially for people that find mammograms uncomfortable. So, they're trying to find a different way. And, I explain, just as you have, that unfortunately for right now, the
It's
mammogram
the best way. Yeah, so over the last few decades, the survival for people diagnosed with breast cancer has increased tremendously. And a lot of that is attributed to mammograms. Mammograms save lives. Like, that's just the truth, The other thing I want to do is take a moment to talk about something that's kind of sometimes used, but not excellent, okay? So you may have heard of thermograms. Some people will talk about trying to get thermograms every year instead of mammograms. A thermogram is this test where they use the heat signature from the breast to detect if there's a place that may be abnormal. And so some medical spas or places like that may do thermograms and offer it to people as though they've been screened for breast cancer. The truth is that when the data has been examined, the thermograms have a much, much, much lower rate of being able to find a cancer than a mammogram. So it, really gives people a false sense of security. What they're trying to do by doing the thermogram is have something that's maybe more comfortable. They're worried about the radiation from mammograms, those sorts of things. But we find that thermograms miss a lot of cancers. And even when a thermogram finds something, it's often not something that is a cancer. And when a thermogram finds something, the first thing they say is, go get a mammogram. So you end up back in the same place, except maybe later. So if there's one thing that I want to say to all you lovely people is mammogram, mammogram, mammogram. Definitely the way to go. Now, if somebody is young, you may be at an age where you're so young that your breast will be so dense on mammogram, it's not helpful. So we're talking about women in their 20s, for example, or in their teens. We may start with an ultrasound and only do the mammogram if necessary. But really, anybody over 30, mammograms are what we would consider to be our workhorse.
Awesome. Thank you. Thank you for saying that. And that goes also for ultrasounds. I think some people are trying to bypass the mammogram by using just an ultrasound. And again, that's not the recommended way to screen.
Agreed. Agreed.
So I want us to talk a little bit more about one of the projects that you are doing. I found that so intriguing. This is a research initiative where you teach other doctors around the world about breast cancer screening. And please tell us more about that.
Yeah, how much time do you have? For a few years now, I used to do this, just after hours on my own time, started creating some video lectures, very technical lectures for radiologists around the world to help with breast imaging, how to detect cancers, how to find things that may mimic cancer but are not worth worrying about, and created an online course for radiologists or trainees or learners in any way that were interested in learning more about radiology to improve detection of breast cancer. So we initially piloted this in Singapore, actually in 2020. It turns out we piloted this online course, right as COVID hit. So as you can imagine, it picked up a lot of traction really, really quickly. Which, grateful to God for. And so we've had the opportunity because of that to expand the work. And my heart has always been to expand it to countries with lower resources, countries in Africa, low and middle income countries, so that we can make sure they're getting really high quality education as a way to do our part to help to balance some of the health disparities. For example, we know that in low and middle income countries, the breast cancer survival is around 40% in 5 years, which is dramatically lower than what we get in the United States. So what we are doing is creating this course to train radiologists, residents, healthcare workers to just participate more, to know more about how to find cancer early. We actually also have monthly meetings where we talk about some of the ways that we manage breast cancer here to see if we can help to modify what available resources these practitioners have at hand to help treat patients in their countries. Now, I have to put in a plug that the healthcare workers practicing in low and middle income countries are brilliant. I mean, they're just so incredibly brilliant. And so we're able to learn from each other and create this online community, and everyone's just doing it because they're passionate. Nobody on here is, getting paid to join this, and it's sometimes a really inconvenient time for the practitioners in these countries, but they're joining. So far we have practitioners from Nigeria and Zambia, and that was my goal. I had 3 sites in those 2 countries, and now we're up to like 10 sites in 4 countries, and like all these other sites that are interested. And I see someone in the chat is talking about practitioners from Guinea in West Africa. Yes, reach out to me. I'm happy.
Uh-oh.
If you or any other, did you lose my video? What happened?
Just for a second, but
okay, good. Yeah, so if you or any other practitioners that you may know is interested, yes, we're definitely willing to join, willing to have them join.
Yes, that's a great a wonderful. I think just collaborating with other doctors in other countries and bringing the service to them is just awesome. So
Yeah.
thank you for doing it, and I know it's such important work. So so glad that you're taking that on. So do you have any? I know we can, but do you have any words of advice or quotes or want to leave our listeners with today?
I would say that I think that I want people to know that there's always hope. I think that that's one of the most important things is that there is always hope. If you are in a situation where you feel a lump or you're worried about a lump or something like that, don't let the anxiety get the best of you. Talk to your doctor, talk to your radiologist. There's always a plan. We can always come up with a plan. And I guess that also applies for the other thing regarding the grants, which is that whatever you're passionate about, I mean, look at you with your clinic, right? There's always hope. You know, when you're alive, there's always a way to make your life a little bit better, to work towards your dreams. So those would be my parting words.
Oh, that's so cool. It's so funny because in one of my exam rooms, that's what it says. It says, I will hope. So it's connected so many levels. But
This is why we're friends.
awesome. So thank you so much for being here. Just thank you for listening, everyone that has joined us, and thank you for the comments. We'll definitely reach back out to you. Remember, please share with someone that might need this. And if you're in the Houston area and you need a primary care doctor that is detailed, proactive about your care, check us out at In Touch Primary Care. You can find more information on our website. Will be posted, or which is actually in the link. And lastly, we have a free informational webinar this Saturday. We're going to be discussing how to lower your blood pressure with lifestyle changes. And it's this Saturday at 12 noon. And the link to register for that in the bio. But you'll have opportunities to ask questions. And if you know anyone that has high blood pressure, or if you have high blood pressure, please join us. Thank you so much, Dr. Omofoye, for being here.
Thank you for having me.
And thank you all of you for joining us. Have a good day.
Bye.
Bye.